My name is Dr. Josh, and we have AtlasMD. We opened September 2nd, 2010, straight out of residency with 0 patients and a dream to not go bankrupt. I've made that joke at the last couple AAPS conferences. So now 4+ years later, it's thriving. And it's exciting to be able to come out and help a lot of other doctors do a similar model. I'll try to keep it short so that we can get through all of our speakers and leave time for Q&A, and I'll be available afterwards for anyone who has questions. But to summarize our model, it's a membership, much like a gym. We charge $10 for children, $50, $75, or $100 for adults through the age ranges, and that's for unlimited home visits, work visits, office visits, technology visits like email, webcam, cell phone, texting, Twitter, Facebook, and Skype. No copays, and then any procedure we can do in the office is included free of charge. So stitches, biopsies, joint injections, ultrasounds, DEXA, spirometry, Holters, rapid streps, UAs, cryotherapy, lesion removal, basically anything. And then one of the things that makes us really unique is we dispense medications and labs out of our office wholesale. And we're fortunate to be in Kansas, where, like 44 other states, we're allowed to dispense medications. So that ends up being an enormous value for our patients, often justifies the cost of the whole membership, sometimes for the whole family. So a box of Imitrex that may be anywhere from $88 to $256 cash price at the pharmacy, we get for $6. So for a patient who the difference between being employed and unemployed is having their migraines controlled, it's a very valuable service to them. So the idea is that we want to focus on quality, not quantity. Instead of the average doctor having 30, 40 patients a day, we see 5 or 6. And that's usually based on our flu season volume. And that's at least in the office. Our average appointment runs about 45 minutes, so we have plenty of time to sit and take care of our patients. We also do a lot by email and phone calls because especially in the winter weather, patients don't want to get out if they don't have to. And if we can avoid contagious people, that's even better. So we can take the full value of our clinic model of the unlimited visits, no copays, free procedures, wholesale meds and labs, and we can go to the employer. We used to be able to help with individuals, but the Affordable Care Act has changed that some. But if anything, the Affordable Care Act is really driving employers to a direct care model because it's the most cost effective and really the most logical. We talked a lot about value before, and I think just that the direct care model is a very value-rich proposition. Because the employer can do typically a self-funded plan or an ERISA-type plan, they have a lot more options to tweak their policy. And what they can do is carve out family medicine, primary care, labs, prescriptions, procedures, copays, urgent care, all these expensive things, and roll it back in with just direct primary care. So now we can go to an employer and decrease their insurance premiums by 30 to 60%. So we can lower their insurance enough the employees get a raise. So I think a lot of doctors worry about the doom and gloom that's coming towards them with meaningful use and ICD-10 and the SGR fix and all these things, we're really thriving. We're finding more and more employers seeking us out. We need doctors, so if anybody's interested in moving to Wichita, it's a lovely town, because we're filling up fast. We cap out at 600 patients per doctor because we want to focus on quality, not quantity. That way we have a reasonable work experience during the day, reasonable after hours call, but we also can be very valuable to our patients. Managing a gentleman who might have to put a hospice soon, and of course we'll come in after hours. We want to save you an ER visit. An ER visit for stitches might be $1,500, but only 20 or 30 minutes of my time. So as the case usually is, it's a holiday, Thanksgiving, someone was cleaning the turkey, but at the end of the night, it's 10:30 and they cut themselves and they give me a call. And I meet them at the office, and in 30 minutes they're home with 3 stitches and I'm back home too. It's that goal of being valuable and being available to our patients, but at the same time not being burnt out. Like one of the presenters talked about, is that empathy. And then once that's gone, I think that really harms our patients. So we need a model that allows physicians to love practicing medicine again, to actually like your patients, heaven forbid, and vice versa. So because we have time to listen, to focus on our patients, to be there, I think we get better outcomes. We can probably prove it, but Our patients don't get antibiotics when they shouldn't because we can have time to talk with them. And it's not a one and done relationship like urgent care. It's, if nothing else, you paid for the 1 month, so they're more likely to come back and continue talking to us. And we say, don't worry, I'll give you antibiotics if you need them, but in the meantime, let's do X, Y, and Z. Or with blood work, CBC is $1.50. Lipid panels, $3. Metabolic panels, $4, $4.50. So it's incredibly cheap to do these things. The nice part about the business model, though, is we structure it so it's the patient's responsibility. We can do a rheumatoid workup for about $12, rheumatoid factor, SED rate, CRP, and an ANA panel, but it's the patient's $12. So now they have an interest in being judicious with their dollars, and we're not involving insurance because we don't need insurance for these things. Insurance is meant for car wrecks, cancers, heart attacks, not for LASIKs that I get for a penny a pill. Actually, it's a little less than a penny a pill. We get 1,000 of them for $8.97. So we've actually been to Walmart in Bentonville and spoke to executives and told them we out-Walmarted Walmart, which was a lot of fun, and I didn't realize maybe quite how big of a challenge that was in the beginning because it was so simple for us. Even with their massive buying power, they're still trying to add on fees, and they're trying to make a profit, which they should, but in a sense, little companies eat big companies all the time. Even individual physicians can outmaneuver a giant company like this when we change our business model to really focus on the patient. Now, I don't need to make money on the medications and labs. In fact, I don't want to because I'd rather have the trust with the patients than the profit from a penny a pill. And when the patient knows that I have their best interest in mind and that, hey, your simvastatin 60 cents a month, even if I was making 100% of that, it's not enough to really sway me. But we have the time to talk to them about that, retest their blood work, and really make focused care, get more care, but you're still making everything cheaper. Pathology, we go to Cole Diagnostics in Boise, Idaho. It's $40 a sample. It used to be $300 a sample for us. So as we strive to be the Walmart and the Amazon for our patients of driving prices down, they're getting a better value. They can get more tests cheaper. They can get more appropriate work done because they have more time to talk with their doctor. And so we've now grown from 1 physician and 0 patients to 3 physicians and 1,800 plus patients. So the model is working really well, and I look forward to answering your questions in the Q&A. Thank you.